Thank you, Professor Marr and the Gerald Lee Charitable Trust for the invitation to speak today. I'm going to cover the main infectious challenges to young racehorses in training and pre-training. Next slide, please. And really just covering the bread and butter diseases that confront horses in training rather than some of the rarer ones. Next slide, please. And obviously the main challenge, which everyone thinks of, is lower respiratory tract disease. So this is coughing, increased tracheal mucus if you were to view the trachea endoscopically, with or without a dirty nose. And most of these horses aren't unwell, so they're not horses that generally throw temperatures, although sporadically temperatures will be raised. It's a self-limiting disease. We know from some fairly good research in the past that horses that scope dirty and cough experience this for only 2 to 3 weeks before clearing it up themselves, with no real progression to anything more serious, although a very small number of cases go on to develop persistent problems with coughing and tracheal mucus throughout the remainder of that season, and that's sometimes due to allergy, sometimes due to recurrent infection, sometimes difficult to unpick. Next slide, please. So this is obviously very common, and once again, we know pretty well the proportions of horses that will be affected in any given year, and so about 80% of 2-year-olds will experience an episode of coughing and dirty scope, tracheal mucus at least once during their 2-year-old season, and that's much greater than older horses, so about 25% for 3-year-olds. That equates in a 100-horse yard to about 10 cases every month, and that's if you were to look down a scope, obviously, rather than necessarily noticing anything externally. That can vary considerably between yards and between seasons in the same yard. So the average yard will potentially go for many seasons without a coughing problem, and then can be plagued by it during the course of one season. And we know that this is a disease that peaks in early spring, although it can crop up at any time. Next slide, please. The science to date supports bacterial rather than viral causes being primarily responsible for these coughing episodes. Sometimes that's a bit difficult to unpick, particularly if a viral disease has gone through unnoticed earlier. However, consistently in many previous scientific reports, several bacterial species keep cropping up as being associated with coughing. They're listed there. Next slide, please. That's not to say that viruses can't be implicated in these episodes. However, they're a much less common cause of coughing, but we need to note that in the UK they're endemic and they circulate periodically. And what do viruses do? Well, viruses can affect the respiratory tract and the immune system in a multitude of ways. They can change the bacterial population in the upper airway, and they can lead to secondary colonization of the lower airway by bacteria that normally reside in the airway anyway. And they do this by damaging the cells that clear the mucus and debris out of the lungs. So you can see in that image there, the ciliated cells, the wave-like movement of those cells moves mucus and the trapped pathogens and dust from deep in the lung to outside. And if anything interferes with that function, that can lead to secondary bacterial colonization. We also, I note there, just as an addendum, that there are viruses that affect the upper airway, so a classic sort of upper head cold in people, starting to be investigated more, but probably no direct link with the bulk of coughing that we see in the lower arising from the lower airway. Next slide, please. So the next common thing, obviously, is worth talking about is ringworm. Ringworm's a fungal skin infection, very common. And it's worth saying that while spores can persist for years in the environment, actually it's direct and indirect contact, usually through tack, that spreads it in racehorses. They're opportunistic invaders of the outer cornified layer of the skin, and anything that upsets the balance at skin level, so sweat, moisture during winter, pressure, trauma, can let the infection in. And it's worth mentioning that the signs take considerable length of time to develop. Next slide, please. And then finally, and we won't spend much time on these, but they're worth mentioning because they come into play when considering biosecurity. The less common, and I guess one would consider them external threats to the health of a racing yard. So strangles is the big one. So it's a bacterial infection of the upper respiratory tract. And the other one worth mentioning is neurological manifestations of herpes virus. So while herpes virus is very common and widespread in horses in the UK and elsewhere, the neurological syndrome that sometimes arises that results in lockdown of yards is a very rare occurrence. Next slide, please. So just running through the fundamentals of immunity. Next slide again. So that we can get an idea of how these diseases arise and how we prepare racehorses better for their life in training. We'll start with the lower respiratory tract. So it's worth mentioning that the lower airways aren't sterile. So there's, as with most parts of the body, human and otherwise, there's a normal population of bacteria that resides there. And it's likely, but we don't know a lot because there's still a lot of research to be done, but it's likely that many of the common bacterial species that cause coughing in racehorses are opportunistic. So they're either around in the normal flora or various strains with greater or lower virulence factors rise to the top of the heap and create disease when circumstances allow. But we don't, unlike viruses where a lot of research has been done, we don't know very much about the relationships between these bacteria and between viruses and bacteria, incubations, periods as such. So a lot more work to do. Next slide, please. Things we do know related to immunity is that the prevalence and incidence of coughing in racing yards diminishes with age. So beyond the first half of a 2-year-old's first season in training, it's quite unlikely that they're going to get an episode of coughing. And this reduced incidence with maturity implies very strongly that horses develop an immunity, an innate immunity to the garden variety bugs. Next slide, please. So one of the primary bugs involved in coughing is Streptococcus zooepidemicus. And we understand that there are a large number of strains, a lot of genetic diversity, and the laboratory results that vets get when they put in a tracheal wash will simply state strep zoo. They won't necessarily go beyond that. So we need to know more about these bacteria. However, we know from the genetic diversity involved in some of these streps that the development of an effective vaccine is going to be very difficult and probably unlikely in the short term. But we know some work from strangles, we know, which is a closely related bacteria, that horses that have been exposed do develop a fairly solid and enduring immunity in the majority of cases. So talking about the viruses involving the respiratory tract, we'll touch on these briefly because it's not really the subject of this talk, but it's worth noting that herpes virus is widespread and horses are exposed early in life as a matter of course. It's notable for its latency. So once a horse has been infected, the virus can persist without signs or shedding until reactivation, when a horse is stressed, moved, and that can be a source of infection to horses around it. With respect to equine influenza, strains, as we've seen last year, strains evolve and change in importance over time, and recommendations for updating vaccines are made on a regular basis to vaccine producers. It's important to say that vaccine choice and compliance are very important in optimizing protection in a racing yard. However, by and large, vaccination and vaccination protocols in racing are reasonably effective at minimizing outbreaks primarily attributable to viral disease. And just touching briefly on immunity, more and more is becoming known in people particularly about non-specific but very protective immune responses that develop in response to, we're all unique, and we're all a product of the antigenic experience that have shaped us. And it's becoming more aware through a very complex chain of events that there's a level of immunity that develops over time that is protective, and it's different to the cross-reactive acquired immunity we see to specific pathogens. On to ringworm. So it's just worth mentioning here, and this would explain the reasons why we see recurrent ringworm even in older horses, and the frustrations that yard staff and vets have with treating ringworm in yards. The body's response is primarily cell-mediated, so antibodies play only a very minor role. They just simply don't get up to where the fungi attack the skin, and this, next slide, please. This explains why immunity is relative rather than absolute, and explains chronic and recurrent infections. There's likely to be a role of individual susceptibility depending on moisture of skin and various factors that also comes into play. And unfortunately, in horses, we're not able to vaccinate for ringworm, but we tend to find, once again, that beyond a certain age, ringworm is unlikely to be encountered in horses in training to any great extent. Next slide, please. And again, sorry. And then now we'll talk about how do we prepare the racehorse for a training career less troubled by infectious challenges. Next slide, please. So we've all obviously been exposed a lot to talk of herd immunity in these months, and it certainly is relevant to the racehorse population. So we know that exposure to the common respiratory and fungal pathogens is inevitable in a training career, and that immunity to those must be acquired naturally because we don't have vaccines for them. So they have to be exposed. They will be exposed at some point, but they have to develop effective immunity. Next slide, please. Obviously, it's very advantageous if that exposure happens at a time that doesn't interrupt a training career or racing season. So early in training or prior to training is best. And we know it's often said that young racehorses are just like school children entering school. A lot of mixing, a lot of exposure to bugs, and they develop immunity that way. And it's absolutely true. So it's been proven in people that children who start group childcare early in life, that while they experience higher levels of respiratory tract disease during that early phase, they're then much healthier throughout later schooling. And the same would be our experience in racehorses. So particularly notable for homebreds that have bypassed the sales season. They're often the horses that when they finally do come into training yards, not having been exposed to all the mixing in the autumn, these are horses that often are plagued by infections or develop infections at the wrong time. And that goes for ringworm as well as lower respiratory tract disease. Next slide, please. So it's important as a strategy to utilize that sales season and pre-training yard phase to allow recruits to the yard to mix, expose them to disease, and one could almost utilize the pre-training phase as a quarantine facility as well, to keep the main racing yard as healthy as possible and less likely to succumb to problems during the year. In my view, and this is an area that needs more research, but in my view, it's not best practice to aggressively treat infections during this pre-training phase, unless signs persist beyond the normal period that you'd expect. So I generally give advice that yearlings and young 2-year-olds don't get treated aggressively unless their snotty noses and coughs don't clear up after a matter of weeks. Providing they're healthy and not throwing temperatures, then it's probably best to let the disease run its course. Obviously, ringworm is different and one doesn't want to spread ringworm, so ringworm needs to be treated. Next slide, please. Part of the strategy is also to protect the horses in the main yard and horses that might still be running. So the tricky, highlighted here on this calendar, the tricky period is the overlap between when yearlings might be coming into a yard and between that and the end of the season. We're talking flat season here. And so ideally one wouldn't introduce yearlings to a yard, or at least in close proximity within that yard to horses that are still running during that end of season phase. And then a strategic vaccination program that prepares the yard for this influx of horses, young horses, but also that prepares the horses for the racing season. So we know that for influenza, for example, that horses are much better protected if they've had a vaccination within the last 6 months. So loosely speaking, it's worthwhile to consider vaccinating in the autumn prior to yearlings coming in, and also pre-season to give horses a good immunity that will last throughout the season. Obviously, we're now in a very complex regulatory landscape with not just vaccinations mandated by the BHA, but also many horses are being vaccinated for herpes virus to comply with French regulations. So it's fair to say that under-vaccinating is probably going to be a thing of the past. It's more about when you time those vaccinations to strategically get your way through the year. Next slide, please. Biosecurity protocols necessarily depend on yard circumstances, and all the recommendations talk about 10 to 21 day period of keeping horses isolated when they arrive in a yard. And unfortunately, that just isn't feasible in most situations. So true quarantine, where you're isolating horses, you have separate staff, you have disinfection facilities, almost impossible in a UK racing yard, an average UK racing yard, not just because of yard layout, but also because of staff logistics. So most of the time biosecurity has to be a best fit. It's also not feasible to isolate horses when they come back from racing, and when horses coming back from racing are probably one of the biggest potential sources of introducing infection back to the yard. So really it comes down to looking at individual circumstances and judging risk based on the individuals. So horses coming from certain countries certain sales, certain pre-training yards might be viewed with higher levels of suspicion than horses coming from locally well-known pre-training yards or studs that have their own protocols, and the trainer will have to play that one by ear. Next slide, please. Biosecurity is probably more relevant to the rare threats, so the strangles type of situations, than for the common garden variety bacterial causes of coughing. And the financial implications of a strangles outbreak or a neurological herpes virus outbreak can be severe. So potentially weeks to months of a yard shutdown, expensive testing. Strangles itself is a difficult disease to control. Thankfully, in racehorses, it's not present in very many horses, so the prevalence is low. The main risk is probably from recently infected horses, although we know that horses can remain long-term carriers of the bacteria in their guttural pouches. Next slide, please. Once again, protocols to prevent the introduction of strangles into a yard vary from none at all right through to quite rigorous protocols. And the training yard will have to make their own decisions regarding the economics and viability of introducing measures to prevent strangles being introduced. If people want a fairly low-end, common sense way to approach it, it would be to blood screen for the antibodies for strangles. However, as with all serological tests, one sometimes needs to see whether antibodies rise to determine whether horses have recently been exposed. And also, particularly relevant in the UK, some recent research suggests that there's a poor correlation between the antibody level and the risk of a horse carrying the bacteria in its guttural pouches. So blood testing definitely worth doing, and trainers who've had previous scares with strangles will tend to have more rigorous protocols, but it's not foolproof, and veterinary advice is needed to come up with a good protocol. Next slide, please. Just worth mentioning on biosecurity that when a horse comes into a yard and develops a temperature within a few days, it's often assumed that the horse has brought something in, but it should also be just as much open for consideration that the horse has picked up something that was resident in the yard. And also just worth mentioning that shipping fever is typically considered not to be a sort of contagious or catching disease. So when a case of pneumonia or pleuropneumonia arises in one of my yards, we tend not to view them as isolation cases necessarily, unless other evidence suggests otherwise. Next slide, please. Yard hygiene is important, but one of those unquantifiable things. So lots of yards will dip chiffonies and bridles between horses, disinfection of tack. Some yards will fumigate indoor rides, steam clean boxes regularly, very regularly. However, a lot of these procedures, there's very little evidence. Doesn't mean to say it doesn't help, but there's very little evidence to support efficacy in reducing the incidence of coughing. It's important to make staff aware that interactions with other yards, ponies outside of racing, also pose a significant threat to the health of the horses in the yard. Next slide, please. Always good policy to be vigilant to signs of disease, and good education of senior yard staff is crucial. Daily monitoring of temperatures can be slightly tedious, but is invaluable in picking up some of those situations of disease in a yard before they become evident, manifest through sick horses and coughing. And one can get a very good idea about the health of a yard from its log of temperatures. Also logging coughs at exercise, filled legs, etc. Next slide, please. And then just vigilance in terms of ringworm with regard to the BHA rules on certification for horses going to the races with skin lesions. It's usually my advice that if it looks like ringworm, treat it as such, and for yard staff to log that treatment in yard records so that if certification is necessary down the line, there are records there to say when it started training. Next slide, please. And again. So now we're on to managing respiratory disease primarily. So what are the fundamentals? And it's worth just running through these, but also just remembering these when we're considering how we approach a situation of respiratory tract disease in a yard. So most of these coughing situations, they're self-limiting. So the individual horse and the yard will get over the coughing spell regardless of any interventions, medical or otherwise. These are not horses that are going to get sick and die. These are horses that the primary problem is the impact on racing performance of the individual and of the yard. So it follows that depending on yard circumstances, and particularly depending on the time of year, one might take diametrically opposed approaches to managing coughing in a yard. So one isn't going to be aggressive potentially in midwinter, but approaching a racing season, one might start to throw a lot of diagnostic or treatment work at a yard. One size doesn't fit all. Next slide, please. It's also worth remembering that there's always some background noise of disease, respiratory disease, particularly in a racing yard. So sporadic temperatures, sporadic dirty noses, sporadic coughing in any training yard at any time of year. Generally, if these do affect an individual, these can be treated on an individual basis successfully. So temperatures, coughing don't necessarily herald a problem yard wide and should be viewed more on an individual basis, but that the yard and veterinary staff remain vigilant to any signs that there's a wider spread problem developing. Next slide, please. And it also worth mentioning that in well-vaccinated UK racing yards, it's usually not possible to distinguish clinically whether bacteria or virus is responsible for coughing. So isolated high temperatures don't necessarily mean viruses. And most times that horses are encountered with a high temperature in yards, they settle successfully with a treatment or two of bute and don't develop into anything. However, if you get a pattern of several horses in a shorter period of time throwing high temperatures or developing coughing, or just uncharacteristic things like bleeding, EIPH, out of character, then that might herald the beginning of a more serious problem. Next slide, please. So the approach that one takes has trade-offs like anything. So early and accurate assessment of cause gives you a better opportunity to make better decisions. It usually means earlier recovery, but the main trade-off is cost. Next slide, please. So when one considers the costs of intervention, treatment, diagnosis, they're the obvious costs. A hidden cost that sometimes isn't considered is that if the response is overzealous, there can be a cost in terms of horses being dropped out of training and missing racing targets that they might not have needed to. And that wastage is important, and we see it all the time. And this is where the experience of a trainer and vet team really comes into it. And sometimes holding your nerve can be just as important as early action. Next slide, please. It's important to establish when you're trying at the outset to work out if you've got a yard problem and how to manage it. It's important to recognize in the first instance that it's probably been bubbling away for a period of time before you were involved. So trying to establish where on that infection timeline the yard is quite important, and it guides your approach to treatment. Try to gather as much information at the outset as possible with the resources available. Next slide, please. And not all of that means spending money. So careful questioning of the trainer and training staff to gauge how worried they are, when coughing started, are there sick horses involved, are horses running flat? All that information thrown in together can guide management going forward and stop inappropriate management. Next slide, please. As we've mentioned, keeping a log of daily coughs can be really important, and one can often gauge the health of a yard, less useful individually, but there is a correlation between coughing and tracheal mucus. So if one keeps a log of whether coughs are going up or down or going through certain age groups in a yard, you can get a very good idea about whether this is a yard-wide problem and whether it's resolving naturally or whether it needs intervention. Next slide, please. However, the best way, obviously, to determine whether horses have a respiratory tract infection is to scope. And this is the only way to pick up those horses that have got mucus that aren't coughing. So horses can have a considerable amount of increased tracheal mucus and yet show no external signs. So we often, at the outset of a yard problem, try to establish how many horses, what proportion of the yard are affected, which horses are affected, which age groups, which barns. And the best way to do that often is just to do a cross-section of survey of scoping. So pick a few. Circumstances differ between yards, but often it's a case of recommending that sick horses are scoped, apparently healthy horses are scoped, 2-year-olds are scoped, and older horses are scoped. Perhaps 2 or 3 or half a dozen of each of those groups will give you a very good handle on the extent of the problem in a yard. Next slide, please. Lab work can go hand in hand with the scoping, so submitting samples for bacteriological analysis is useful if you think you're at the outset of a problem. It's not something I would rely upon on an individual basis all the time, but if one was at the beginning of a curve of worrying about whether a yard is getting ill, then it's always worth submitting samples for bacteriology before you initiate treatment. Also, following up on treatment by rescoping horses and establishing how quickly they're resolving the problem can be very useful. And often it's possible to make a good guess as to how to manage and which drugs to use based on the history of coughs, the scope appearance, and the progression through the yard. Next slide, please. Blood sampling isn't particularly useful it's not a sensitive or specific test for horses that have got increased tracheal mucus, but it can be used more loosely to gauge the health of the yard. So never to be used as a substitute for scoping, but can be certainly used as an adjunct to determine how healthy the yard is. The most common scenario is you see just a slight elevation, some of the inflammatory markers across the board in the yard. So horses with fibrinogens and SAAs on their blood reports that should be very tight and low reference range might just sneak up to above reference range across the board. Next slide, please. Incorporating virology as part of your diagnostic workup is not always that clear cut. So as we've already mentioned, viruses are less commonly implicated than bacteria in most coughing episodes in racing yards. And also many yards are very well vaccinated now. And often in the past, particularly when diagnosis of a viral problem relied more upon antibody rise than on swabbing. The information gained is more useful oftentimes after the event than during it. So planning for future health programs. Next slide, please. The other thing that's worth mentioning with regard to virology is that there are regulatory obligations if you get a confirmed positive to some diseases. So the BHA demands notification if equine influenza is diagnosed. It can also seriously impact upon a vet's ability to certify horses for travel. And in this day and age of the international calendar being very full, if one were to diagnose a viral disease through potentially over-exuberant use of diagnostic work at the outset of an outbreak, then it might not be possible to sign health papers for certain jurisdictions. And those health papers will be worded differently for different countries. But for example, if flu's found in a yard, you would not be able to certify a horse for Australia for 30 days. And that's entirely appropriate. However, the sanction is quite great considering that there's low-grade respiratory disease bubbling around for much of the year. Next slide, please. And then just additional testing is sometimes thrown at these problems by trainers and their advisors. So environmental testing for dust, for mold counts, for ammonia, mycotoxins, analysis of hay. However, we know these situations are usually infection-based and they're transient. And so these sorts of testing procedures, while they might be useful to improve the long-term health of a yard, they're not very applicable to the infectious challenge. Next slide, please. So when it comes down to treatment, one has to decide whether you treat the yard or the individual, and that's determined by all the factors that we've already mentioned. Costs can be really substantial, and so hopefully one's arrived at this point having done quite a bit of investigation, both diagnostic and just asking questions, and one can start to work out how to approach the problem. Certainly some basics are, one has to prioritize the health of horses that might be running in the near future. Next slide, please. Exercise is one of these imponderables. So it would be common practice to drop a horse that's got increased tracheal mucus out of full work, so not galloping, but they would continue to canter throughout the period that they're dirty. And this has always come back to this presumption that one doesn't want to stress both the horse and the respiratory tract while it's fighting off an infectious challenge. And that's probably a reasonable thing to say. There's also a presumption that some of these horses might be predisposed to bleeding. However, that link is a little bit tenuous. But it would be common practice for a horse that scopes dirty to be dropped out of full work for a week or two. But this is an area where the science is limited or non-existent, and there probably aren't any rights or wrongs. Next slide, please. When to use antibiotics. So clearly, in the current landscape of antimicrobial stewardship, which is very important, some measures that are being put in place to try and reduce the increase of antibiotic resistance in bacteria across the board, and particularly bacteria that have an effect on human health. So it's important only to use them when necessary. And so, as we've said earlier, respiratory infections in winter, where horses aren't running, potentially is not. It's not obligatory to use antibiotics, and indeed one might reserve them for more important times of the year. selection based on laboratory results, likely pathogen, and as we've said before, an educated guess can sometimes be as good and faster than laboratory work. Appropriate dosing regime, and then there are certain protected classes of drugs which include, by trade name, Exenel and Batril, Lanflox, which we try to avoid using as a first line of defense for some of these infections. Next slide, please. So just to illustrate this, it's worth just mentioning here some work that Lorraine Palmer and our laboratory did over the course of 14 years of submissions of racehorse tracheal washes to the laboratory, trying to determine whether any patterns were being seen in terms of resistance. So this was presented a couple of years ago at Beaver Congress. It's the largest data set of tracheal aspirate investigation in thoroughbreds reported to date, and it compared sensitivity patterns between the key bacteria implicated in coughing between two periods. And it was sort of interesting because for as long as I've been in Newmarket, injectable oxytetracycline has been the most commonly used antibiotic for everything, whether it's coughing or infected legs. And so throughout this period, it's been the most commonly administered antibiotic. And you can see that between period 1 earlier and period 2, there was a drop-off in usefulness of oxytetracycline in treating beta hemolytic strep. So one of the primary bugs involved in coughing and other diseases in racehorses, the second period of sampling showed that there was a much lower sensitivity of those bugs to oxytetracycline, and conversely, a drug that hasn't been used that much as a first line of defense against infections, trimethoprim sulfonamides, so oral antibiotics, the sensitivity increased over that period. So one can see that on the graph. So the red columns are the P2 second period. And you can see the rise in sensitivity of beta hemolytic streps to trimethoprim. So that's a useful thing to bear in mind. It's worth mentioning these things haven't undergone rigorous statistical analysis yet, but the figures are quite impressive and would point towards reaffirming the message that antimicrobial stewardship is important. Next slide, please. And then just some additional therapies worth just mentioning briefly, but I won't go into these. If a viral outbreak is considered likely, then such as last year with the influenza situation, then a booster vaccination in the face of it might be an appropriate measure. Drugs such as clenbuterol tend to be used far less in my experience these days than previously. And immune stimulants are sometimes considered if a problem arises, but not used universally by any means. And then finally, ensuring the health of runners. So it's generally considered that horses that scope dirty are at risk of underperforming, both at a race or in a gallop. However, it's not so clear-cut. The science doesn't universally support this. There have been a couple of scoping studies, one in the US, one in South Africa, one in Australia, and there have been variable associations between tracheal mucus and performance. So it's not a clear-cut thing. So one cannot say that a horse that scopes dirty will not win its race. And next slide, please. And so therefore, judgment on suitability to run should really be based on a lot of factors, not just how it looks down the scope. So coughing history, subjective appraisal of whether a horse looks inflamed in its upper and lower airways, how it last worked. All of these things are important, and also trainer factors are important. So if a horse is thought to be up to the challenge of its next race, regardless of tracheal mucus, it might still be sent to run. So it's not a clear-cut thing, and individual management, as with many things, is the right course of action. It's sensible to, if one is in the middle of a yard coughing problem, it's sensible to ensure the health of, or at least give information about the health of potential runners by scoping them. And that can either be done, once again, depending on the trainer, either immediately pre-declaration or with sufficient time in advance of a run to perhaps allow a course of treatment if it's found to be dirty. So next slide, please. So you can get a full spectrum of interventions, and there are no rights or wrongs, from the very low input, not requiring almost any spend on investigational treatment, where a trainer might decide just not to send out runners for a period of time and using coughing as a health guide, to yards that have a lot of resources that might decide to scope the entire yard and then shut down groups or treat groups of horses depending on their scope results, and not restart until horses are scoped clean. Next slide, please. And then just finally, worth mentioning, again, going back to those exceptional circumstances of challenges arising from the scary diseases like strangles and neurological EHV. These are very stressful situations for trainers and vet teams alike. And appropriate response is really critical for the wider racing community, not just the trainer. Fortunately, there are very good and readily accessible guidelines through the codes of practice primarily, and following those and notifying the BHA, it makes it much easier to navigate those situations. So next slide, please. And finally, and so really just to summarize, herd immunity is the key. Try to get your recruits as healthy as possible. And that's through a combination of pre-season mixing, sales mixing, and a coherent vaccination protocol. Maintain the best possible biosecurity for the yard, knowing that will be incomplete, and that therefore one has to rely quite heavily on vigilance for the early signs of disease. And then a situation-specific response to any disease challenges, and good vet advice and a calm and experienced trainer can certainly assist in managing these problems well. Thank you again, and I think we're now going to go back for some discussion.
Thank you very much, Pete. That was a really useful presentation and covered everything really comprehensively and practically. So I think there's a lot of useful stuff that people can take away there. However, I do feel like maybe here and there was some slightly mixed messages. So towards the end of your presentation, you emphasized the diseases that require reporting to the BHA. I think you called them the scary diseases. And I would agree, you point out that they are quite rare, but nevertheless, the three big ones that are most likely to require reporting and intervention from the veterinary and welfare team are, of course, neurological EHV, influenza, and strangles. But yet, a bit earlier, you talked about there always being some background noise. Can we just drill into that a little bit more? Do you really think that background noise is flu or strangles, or is it not much more likely to be EHV4, perhaps rhinovirus, maybe some of the other herpes viruses like 2 and 5? And I guess one of my pet theories is that there are probably as yet unidentified viruses and bacteria out there. So what is the background noise? Do you think the scary diseases are there and we don't diagnose them? or is the problem that there are a lot of different bacterial and viral pathogens that, at least at the early stage, might look like flu or strangles, for example?
Yeah, thanks, Celia. Yeah, sorry if there was any confusion, and I agree that this is the key role of the clinician, and the dilemma for the clinician is when to be alarmed or begin to be concerned that one of the more serious diseases is at play, and therefore a risk to the individual or to the yard or to the wider racing community, as opposed to the background noise of respiratory disease that we see all the time. And I would agree, and previous work would suggest that the majority of that background noise in most racing jurisdictions is probably actually, from Woods's work and older work, bacterial rather than viral. But the viruses that are probably most implicated would be the herpes viruses, and I agree that there are probably viruses out there that are under investigated and that may reveal themselves in future. So one is always, as a first opinion clinician in a racing yard, dealing with sporadic respiratory illness, both in individuals and small clusters of infection, and sometimes more widespread infection in yards. And previous experience with diagnostic workup of those situations usually yields a mixed bag of bacterial pathogens or opportunistic pathogens, sometimes viruses at play. So there's definitely a difference between that background noise. And I mean, I have to say that strangles is thankfully very rare in the UK racing population. And when those cases arise, they rapidly become quite evident and are traceable, and are dealt with on a much sort of higher alarm level than normal respiratory disease. Neurological herpes obviously is another serious disease. I would venture to say that, in my view, equine influenza does not compare with the seriousness of those other diseases in the UK population in respect of threat to both the individual horse and the yard in which it's stabled. Does that help with that?
Yeah, I mean, actually, we do, as part of this group of presentations, we explore influenza in considerable depth in another webinar. But we all know that it varies from year to year, and one of the misconceptions I think that came out of the 2019 outbreak was that because racing was cancelled, there was a perception that loads of racehorses were ill, and maybe we missed a trick in not using the racehorse population, which are so well vaccinated, as an example of how one can effectively minimize the risk from flu, because there was very little in propagation of infection in comparison to what went on in the general horse population. And I don't want to go on too much about flu because it is picked up in another webinar, but there's no doubt that the problem, the flu is a problem for when it evolves and we get these fluctuations in prevalence and so forth. It's in the general horse population, which are poorly vaccinated, not the racing population. But just sort of coming back to the more racing scenario, in terms of all the way through your presentation, really, you sort of hinted at you've got to make a judgment call as to when to trigger doing more investigations, and we'll come back to the sanctions around that later. But can you give any guidance for how you distinguish that pattern that might be a propagating infection versus a low level, something that's going to effectively be self-limiting?
I think it's very difficult, and this comes back to the good vaccination status of the racing population, and increasingly good vaccination status, given that we're now sort of expected to vaccinate more frequently for influenza, and also a lot of racehorses are vaccinated for herpes virus to make them eligible for racing in France. And so we're dealing with a population that's quite well vaccinated, and therefore even when you get viral disease, and whether that's an equine influenza outbreak or a recurrence of a flare-up of EHV somewhere in a naive group of horses, the clinical signs may be curtailed enough that it doesn't look like the textbook description of flu or herpes virus with persistent high temperatures or persistent cough or snotty nose. So as a first opinion clinician, it's very difficult to look at a horse or the history of a horse presented to you, or a yard with a respiratory problem, and say this looks like a bacterial problem or this looks like a viral problem. And so it does then come down to what sort of diagnostic testing you instigate and when that might be. And you could say, well, every case of respiratory disease, you should find out the causative pathogen, but that just lumps a completely unreasonable financial burden on connections. It's simply not feasible, particularly when we see a lot of respiratory disease at certain times of year. And in my view, it's not wise to be throwing antibiotics around at young horses in a way. We want to establish that herd immunity and allow them to you develop that immunity without too much intervention. And there doesn't appear to be a great risk to the individual with these diseases. But I guess, once again, this comes down to anecdote. There are no rule books as to when you should start testing, and whether that's bacteriological testing from a tracheal wash, or whether that's viral sampling, so either PCR or serological sampling for viral pathogens. There's no rule book. And in a large racing yard, say of 80 to 100 horses, depending on the time of year, you might expect to see a pyrexic horse with or without other respiratory signs every 2 weeks or every 3 weeks. You might experience periods of the year where you have coughing that's spreading through the yard, and you have to make a judgment based on the time of year, on the signs shown. I think if you were to get persistent high temperatures on a number of horses in a short space of time, with or without nasal discharge, with or without coughing, that might lead you to believe that there's an infectious agent. Now, whether that's a bacterial or viral agent, you would have to do some more testing. And I think only in my own experience, only if I saw a cluster that was apparently walking itself around a yard, would I consider it a useful measure to start the ball rolling with diagnostic testing for the pathogen. Obviously, testing is more useful in the early stages of clinical disease, but sometimes you're parachuted into these situations when the disease has already been sort of moving around a yard, sometimes subclinically. So there are no black and white answers, and it comes down to experience and the demands and requirements of the client, the time of year. You're more likely to be acting quickly and wanting to stamp anything out leading into or in the racing season, as opposed to towards the end of the season or in winter. So your approach will differ depending on the kind of animals involved and what time of year it is, and sometimes the financial constraints of the trainer.
Yes, it's really about either identifying exceptions from the norm, so sort of clustering of cases, or as going back to strangles, I guess I think my experience would very much fit with what you've said, that the signs are really quite obvious, and therefore the individual horse with severe and perhaps slightly unusual signs versus that would be one indication for further investigation, and the cluster and evidence of propagation would be the other indication. You sort of go along with that general rule, but
it's tricky, isn't it? Because ultimately, you might have a 2-year-old in a yard that for 3 days, 4 days in a row throws very high temperatures in spite of the administration of non-steroidals. And it is probably likely that horse is going through an EHV infection. Maybe it's naive and it's come into a yard and so that's viral disease. But if the general level of immunity in the yard is good, that might not spread. So we're talking about maybe only testing for viruses if you see clusters or spread in a yard, but actually you can have individual horses exhibiting viral signs where you don't get any spread and you don't get any clustering. So, when do you step in? It has to be very much individual based and come down to the experience, not just of the vet, but of the trainer and the desire of the vet trainer team to limit any further ramifications to the health of the yard.
Yeah, I think when I was talking about individuals with unusual signs, I was more thinking of some of the strangles cases that I've known, which had more than just fever. But anyway, let's move on. You alluded to the one of, obviously there's the financial cost of testing, and that clearly has to be borne by the clients. And then there's this regulatory sanctions. I don't really want to get too far into the BHA because obviously, on being informed that there is potentially a problem, then the BHA is in the relatively fortunate position. They come in and they look at that yard individually, work with the vets, and come up with a plan for how they're going to test. And of course, through the good fortune and long-standing investment of racing, a lot of the costs of all of the financial costs of that will be picked up by funds that are made available by the HBLB, the Racehorse Owners Association, and others such as the TBA. So that it's inconvenient for sure. But one of the things that you touched on that maybe worried me a little bit, and I'm not too sure there's much we can do about that, and I've certainly been in this situation, is how it impacts on regulatory functions like vets signing off horses as appropriate to travel. And I think you used the example of flu and Australia, and actually I would say that's kind of an extreme example because clearly Australia has been very hard hit by flu, and I'm sure would do absolutely everything they can to avoid bringing it back again. But in general, do you think the restrictions that might occur as a result of diagnosing, say, EHV1 in a training yard are overboard, or can you see that it's not a very easy situation when it comes to travel? The problem, I suppose, is that the people making those decisions are a long way away. It's not like phoning up the vet team and the BHA and then being able to work very closely.
I think it's I think in the past, and hopefully with some future tweaking, this will change. But in the past, there's been some ambiguity about which diseases, how far should a vet be concerned about reporting diseases that are present in a yard on up the chain, and whether that's to the BHA or when you're signing international health papers, which the signing of international health papers is a very regular occurrence in UK racing yards. and receiving countries all have different requirements. I guess I should have. I apologise. I didn't explain the point more, and it's one of those subjects you could talk about for a long time, because it is in a way a form of, this sort of buzzword at the moment, strategic ignorance. And what point do you start a diagnostic ball rolling, say for virology testing, to benefit the individual horse or the management of the individual horse, or of its its stablemates and the trainer, where that testing might actually have a blowback in terms of regulatory sanction. And some of the wording of the international health papers is such that it may be the case that many vets just don't realize this and just sign off, but we should all be aware of what we're signing when we're signing health papers. And the Royal College leaves nobody in any doubt, the value of a vet's signature and how we should make sure we're signing off on only correct things. And the wording on many of these health papers pertains to the horse not having been exposed or housed in a stable where there's been confirmed or suspected infectious or contagious disease. And that's a very broad church, as you can imagine. So I think that the example of Australia is fair in terms of they absolutely need to protect against equine influenza. And fortunately, the quarantine procedures, both pre-export quarantine and post-arrival quarantine for Australia, protect them considerably, and swabbing regimes protect them considerably better than in the past. But yeah, it's tricky. I mean, so I don't think a lot of vets would probably think too much about signing a paper on a horse that hadn't itself been affected by respiratory disease, but perhaps there'd been a case of EHV 3 weeks ago in the yard, remote to the horse, not affecting that horse at all. But in some circumstances and for some countries, that would be a form of false certification if you're signing off on horses to go abroad that are coming from a yard that have had infectious viral disease, respiratory disease. So I don't know if that answers the question, but it's sort of tricky. And it's the main point probably is that vets should be very, very aware of what they're signing, and the threat of exporting respiratory disease to other jurisdictions.
Yeah, I think I guess in an ideal world we'd have a bit more of a nuanced approach, wouldn't we? So it wouldn't just say confirmed or suspected, or I forget the exact wording. I haven't signed one of these forms for a long time, but I have in the past, and it's this, any horse in the yard bit, and quite a long period for some of the forms. So really,
the US is
almost impossible to sign. And maybe it like I say, it just needs to be maybe in an ideal world it would be more nuanced. On the other hand, that's the word of regulation. It's difficult to add nuance into it, isn't it?
Yeah, absolutely. And sorry, go ahead.
Well, I was just going to say, I can think of examples where two that are popping to mind, that where we were prompted actually by neurologic signs. We effectively, coincidentally, found HV1 in horses that were, it was completely, ultimately incidental to the fact that there happened to be a neurologic horse. So the EHV is, well, EHV1 and 4 are, the prevalence of latent non-clinical infection is such that there is a chance you'll pick it up as a kind of bystander or coincidental infection, even if you are dealing with a horse that has signs that could potentially be induced by that self-same virus. I've
Well, I think
also,
this is
in the
the whole problem. I mean,
I'm
these are
very,
endemic diseases, aren't
you
they?
know, and complex things like that.
Sorry, I spoke over. Yeah, I mean, the problem is these are endemic diseases, and against the background noise of respiratory disease. I mean, it should. I should come back to the point that, by and large, or not just by and large, almost exclusively, horses going to the racetrack or getting on a plane to go to a racetrack are some of the healthiest horses in, racehorses are some of the healthiest horses in the world. They're the best vaccinated. They're going there because they're healthy and good and in good form and not exhibiting any signs of a problem. And yes, there's the background noise of respiratory disease in racing yards, and in pre-training yards, but by and large, horses leaving the premises to go and perform are the healthiest of the healthy, and it is that distinguishing how, when you need to be alarmed, and begin to initiate diagnostic testing, for something that you consider out of the ordinary, and that's tricky. I think it's much easier for things like strangles. It's very difficult for things like EHV, and yes, equine influenza is far less common, but ultimately it is endemic. And if you test enough horses all year round, you would come up with positives to equine influenza as well.
Yeah, I mean, I think we're probably talking round and round in circles, but the fundamental message is that, and this is where I think perhaps we did score an own goal during the flu outbreak, that the racing population, on the whole, the diseases that we worry about are relatively rare, and because of the level of vigilance, likely to be detected. I think we can probably agree on that. So Fred Barrelet is here. I just wanted to give Fred an opportunity to maybe ask some questions.
Hi, Peter. The dilemma, I think, for many people, and certainly from a regulator's point of view, and the attitude that we sometimes see in the field, those of us who are signing papers or dealing with large populations of horses in larger or smaller confines, is that basically the horse does not live in a sterile environment, and there's an endemic load of pathogens out there that it is always exposed to. And it really is the clinician's job to ascertain whether the movement of horses from one population to another pose a clinical risk to the next population. And that sometimes is very difficult to translate into regulations, regulatory paperwork, and so forth. So we come back to the whole issue again of clinical judgment, and accepting the biology of these pathogens that are circulating.
I suspect Boris Johnson would agree with you. It still is quite challenging. Anyway, David Dugdale is also here. He's joined us from the Newmarket Equine Hospital. So I'm going to hand over now to David. David, do you have some questions for Pete?
Sure. Hello, Pete. Thank you for a very comprehensive review. Can you hear me?
Yes, I can, David. Thank you.
Now, ventilation is often thought as important in respiratory disease, and over the years, different views have been taken of traditional stabling versus American barn stabling, and now a swing back to more traditional stabling. Have you got any views on what the best type of ventilation to minimize respiratory disease in horses in training?
Yeah, I think generally speaking, if one is to generalize, then loose boxes are the healthiest. If one is to talk about dust counts, but it's a very complex area. So first thing to say is, we do talk and have talked for decades about air hygiene. However, these problems are usually transient. So the infections are usually transient, and And I'm sure your experience would probably mirror mine in so much that one can have yards with ostensibly terrible ventilation, horses in old racing yards in Newmarket where they might be tucked in behind another stable, even with only a small upper window. And there are yards like that can consistently have low levels of respiratory problems and good form. And there are other yards that are spotlessly clean with good ventilation that can be plagued by plagued by problems. So it's when we have done, one of my colleagues, Josh Davison, has done quite a lot of work on dust counts. And even within an American barn, for instance, if one tracks the dust during the course of a day and with horses going in and out and boxes being mucked out, it can be a very complex situation. And then that isn't even accounting for the dust that horses might be exposed to in the indoor rides. So you sometimes stand in indoor rides and get exposed to clouds of dust. So very complex. And I'm not sure that, most trainers at the end of the day have to suck it up and make do with the yard that they've been given. I guess if one were to build a yard from scratch, then loose boxes probably have it over American barns, but well designed and well ventilated American barns are relatively healthy as well. Does that answer the question? Sorry for flapping around, but
yes, it does, and it expresses some of the conversations that we do have. On a similar theme, aspergillosis, there is a sort of trend, or has been a trend, for taking samples from stables and barns for aspergillosis, and then taking remedial action by the use of disinfectant fogging. And I'm sure it all helps, but I'm not entirely convinced it's critical. What are your views on testing for aspergillosis and fogging with a disinfectant?
Well, once again, this is something that there are people there are people that obviously subscribe to this sort of analysis and treatment as being a key factor in their confidence, perhaps, and maybe success. But those things haven't really been validated scientifically. And like a lot of things, until one knows what's normal, I think one should always view with a little bit of caution any claims of the success of any treatment. And that goes for whether it's a joint being treated or the respiratory health of a racehorse. And the trouble in this field is that there's not much research out there about what is normal. So one can go to yards, as I've just said, yards that have got terrible, on the face of it, airway health, sending out classic winners time after time. So claims are made, but the science isn't really there. And I would tend to say that, it just doesn't fit that aspergillosis and other respiratory non-infectious challenges, that dealing with those necessarily helps you avoid those big problems with coughing that hit a yard from time to time, because we know that those big problems are infectious. And while you might get a proportion of horses that develop ongoing problems or some low-level poor performance problems from dust or fungal exposure, mycotoxins, that would be a minor component in dealing with respiratory challenge, in my view.
Over the years, when I've been faced with difficult outbreaks of respiratory disease, I've often thought an effective immunostimulant would be what would really help us in those situations. And equally, over the years, we've tried various different things with no great success, if I'm honest. Have you got any experience of immunostimulants in these challenged horses, and anything that helps?
Once again, I'm sure my experience mirrors yours. So one is probably already in the midst of a problem, or on the cusp of a problem. If there's a challenge going around Newmarket, for instance, and one is worried about it, and and if you're already in the middle of a problem and you start to throw the kitchen sink at it, one never knows what works and what doesn't. So on the few occasions that yards decide to throw Xylexis, a course of Xylexis across the board to try and minimize any respiratory problems, or in the past it was Extim from the States, or even vaccinating for cross-protective immunity and general immune boosting. One never knows. So you end up being in these situations before you're prepared, and then is it when a yard comes out relatively unscathed, is it because you did that, or is it because you were scoping and treating or dropping horses out of fast work or more vigilant? I mean, one never knows. I have to say, I never think highly enough of the immune stimulation capabilities of what we can do to recommend it wholeheartedly to trainers. So, for instance, last year in the influenza situation, I recommended it as an option, but didn't push it too hard. And as most yards here in town got through it fine. So with hardly any problems. So I'm not convinced, but I mean they do have an effect on paper, but whether that's worth spending money on is difficult to say.
Good. Thank you, Pete. Just changing themes slightly, you mentioned briefly shipping fever, and before the current pandemic, then global transportation of horses was a very big business. But one of the great drawbacks was a horse getting pleural pneumonia while it's travelling. Have you got any tips or hints that would minimise the risk of a horse getting that infectious disease when it's travelling, usually by plane or for a prolonged period by plane? Have you got any advice that you can give trainers how to minimise that?
Well, I don't have any tips for trainers. So, across the board, really, the international shipping of horses has become a much more professional business. And so traveling grooms really know how to look after a horse, keep it hydrated, letting its head down, all of those things that we know are risk factors for developing an infection. I mean, essentially, if one were to tie a horse's head up for too long, and whether that's, keeping its head up because it needs to be tied up for a pelvic fracture, or whether it's driving up to the north of England to a race or getting on a plane, all of those things reduce a horse's chance of being able to clear inhaled pathogens well from its lower airways, and therefore a proportion of those horses can get ill. However, international travel has become a much better run situation, and so when it comes to, so I don't think the trainer can necessarily do anything. When it comes to, sometimes people call for pre-shipment protocols that involve the use of antibiotics, and the science would suggest that that's not a useful thing to do. So it's more about keeping a horse hydrated and then being very alert when the horse arrives at the other end as to how well it's drinking, how well it's eating, keeping an eye on its temperature and taking some inflammatory profiles on its blood, and then treating those horses early, in the process if they are going to be ill. So as with a lot of things with international travel, what happens at the receiving end is probably more important than pre-shipment.
Good, well, thanks. I agree. This dilemma about whether to give horses antibiotics before long journeys is a question we're often asked, and I'm interested to hear that it's not supported by scientific evidence. Just to return to the lower respiratory tract disease in horses, often once you've got the horses over their infectious component, they're left with a hyperreactive airway, which the trainer keeps saying this horse is not better, it's still coughing. and you look down it and there may be some mucus, but there's no infection there anymore. So managing that sort of hypersensitive airway in the recovery phase, again, how would you go about that?
Yeah, I definitely recognise the syndrome. I would say it only affects a small proportion of animals. Those horses that continue to cough, don't they? You know, the trainer's always getting you to scope it and saying it's coughing 12 every day, and you scope it, and you know, it's clean down its windpipe, and it might even not look overtly inflamed in its upper airway. So, you know, presumably it is a true hypersensitivity reaction, and, you know, no research has really been done on them. I guess, if I've looked down a scope and seen a clean airway once or twice on those horses, I tend to just say to the trainer, ignore it, it's clean. I don't put them on any treatment, whether that's systemic or, you know, upper airway throat sprays and things. I guess that's a different situation to the horse that, and we know it's once again only a very small proportion of horses, but those horses that have an episode of coughing and scoping dirty, and then for the remainder of that season scope dirty on and off, sometimes considerably dirty. Lab results sometimes indicate recurrent infection or ongoing infection, sometimes no infection. When infection can be ruled out, then those horses, in my hands, would tend to go on prednisolone, and response to the prednisolone can be gauged by rescoping, and often the response is good. The other thing we know from previous research is that those horses that are really troublesome, coughing and dirty all year, particularly as a 2-year-old, when they get to their 3-year-old, they're usually not troubled by the same problem. So when you scope those horses, they don't have a lifelong or career-long problem. It's usually transient, but just takes longer.
Thank you very much, Pete. That's been a really useful discussion. So thanks for contributing to our series of lectures today.
Thank you. Pleasure.